Black Health Trust. We're so happy that you were able to join us today. We are going to be talking about a condition that causes great damage in our community, as well as the updates around COVID. Without further ado, I will turn it over to Dr. Randall Maxey.
Thank you very much, Dr. Neighbor Stevens, who's traveling by car through Alligator Alley on her way to Florida. So we wish her safety and good luck. I'm glad she's with us. Our other two co-moderators, Dr. Hines and Dr. Walks, aren't with us today, but we have a number of other advisory members who will be welcome to chime in. This is, I believe, National Lupus Month. And our topic today is going to be lupus, or otherwise systemic lupus erythematosus. And this disease is an extremely complicated and dangerous disease, but we're going to try to unravel some facts and thoughts about it. So I had gone back to some of my old medical school notes, and then it occurred to me that my medical school notes are more than 50 years old. So I had to go someplace else for that. So let's start off from saying, what is lupus? It's a chronic autoimmune disease that can damage any part of the body. Lupus is more common among women of childbearing ages from 15 to 44 years. Now understand that's not exact, but that is the general age range. Lupus can affect any and every organ of your body. And if that sounds familiar, that's like diabetes mellitus can do somewhat the same thing. And there may even be some relationship between those two. So what causes lupus? Well, we're not exactly sure. When I was a fellow and doing a lot of kidney biopsies, we could actually see so-called virus-like bodies embedded in the cells of the kidney. And we thought and think that may be one of the bases of at least the kidney part of the disease when it occurs. But we still have not totally unraveled what causes lupus. It's not a diagnosis that you can catch from somebody else. So you don't have to worry about getting lupus from somebody else, unless you're in utero and she's your mom. And then there may be some thoughts of genetic transfer and some other particles. But we do know that genes do play an important role, but are not the only reason. The environment might play a role, diet can play a role, sunlight, stress, smoking, and certain medical issues, drugs, and also viruses can trigger the symptoms of systemic lupus erythematosus. Hormones, such as estrogen, and we know that lupus is more common in women during their childbearing years when estrogen levels are at their highest. And we also know that it does represent problems with the immune system. So it's basically your immune system attacking your body itself. So these symptoms include muscle and joint pain. Some patients may experience pain and stiffness. Muscle pain and swelling may include neck, thighs, shoulders, upper arms, or pain anywhere. Some patients have fever if it's higher than 100, and this fever often causes relates to inflammation or in possible infection, which sometimes is more frequent in people with lupus. Rashes on any part of the body that are exposed to the sun, such as your face, arms, hands. And a common sign of lupus is what they call a butterfly rash or malar rash that is on the face and across the bridge of the nose and cheeks. Chest pain. Lupus can trigger inflammation of the pleura or the lining of the lungs, and this causes pain when you breathe deeply or inhale deeply, and that can be quite uncomfortable. And some people also have patchy hair loss or bald spots. I've got a few of those, but I don't think it's from lupus. So what are some of the symptoms? We know that sun or light sensitivity can be a symptom, and I mean photosensitivity. It's difficult to see in the light. The exposure to light might also cause a rash, might cause fever, fatigue, or joint pain in the patient. We know that it definitely can cause kidney problems. 50% of the people with lupus also have kidney problems. It's called lupus nephritis. The symptoms include weight gain, swollen ankles, high blood pressure, and decreased kidney function. And we had a lot of those at my training place. So I even gave a paper in Tokyo regarding that. Well, that reminds me of Dr. Jordan's name, Tojo. So it also causes mouth sores, ulcers, and these ulcers can be painful and some don't have pain. They can be in the roof of the mouth. They can also be on the gums, inside the cheeks. And these can be painful, and they also can lead to dry mouth, which is a sign not only of lupus, but of something called Sjogren's syndrome. Prolonged extreme fatigue can be a warning sign of a lupus flare. Anemia can also lead to fatigue. It can also be a bad sign going on with lupus. Other symptoms include memory problems. Some people with lupus report problems of forgetfulness or confusion. Blood clotting. Patients may have a higher risk of blood clotting, and this can cause blood clots in the legs, the lungs, stroke, heart attack, or miscarriages can happen. Eye disease, dry eyes might happen, eye inflammation. So a person with lupus should make sure they have regular and frequent eye exams as well. So who gets lupus? And Simon, can you go to slide number 4, I think we're on. It says, who gets lupus? So African-American women are 3 times more likely to get lupus than white women do. Lupus is also more common in Hispanic, Asian, and Native American and Alaska Native women. African-Americans and Hispanic women get lupus at a younger age. They have more severe symptoms, including kidney problems. There are more problems with seizures, strokes, heart problems that occur, and genes may play a role on how lupus affects minority women. Next slide. SLE, or systemic lupus erythematosus, is the most common type of lupus. SLE can be mild or it can be extremely severe and can affect different parts of the body. There is no one test that will tell you you have ANA, but typically we draw a blood sample that's called an ANA, or an anti-nuclear antibody. And that is indicative that we need to look further. We also need to get a very detailed family medical history, including extended family who are blood relatives, what their symptoms are, and of course, a physical exam will go a long way towards helping us. So with the lab tests we do, there's the ANA, there's a double-stranded DNA complement levels, which may go low, and the erythrocyte sedimentation rate. All of these are blood tests that we get at the lab. Next slide. So there are two major types of cutaneous. Now, the first one we talked about was systemic, meaning the entire body in your blood system. Now, cutaneous basically means skin. And here we're talking about one called discoid lupus, or DLE. And this is a discoidal or circular type rash, which usually begins as a red raised rash that becomes scaly. It often appears on the face and scalp. It can be in other locations, and sores can be in the mouth and the nose. And we know that there's a small chance of developing the systemic version if you have the skin version later. There's also subacute cutaneous lupus erythematosus, which causes skin lesions that appear on parts of the body that are exposed to the sun. We also know that some drugs can cause the symptoms of lupus, but they rarely affect organs. And once you take the drug away, the symptoms go away. So we also know that medications for other chronic diseases, such as hypertension and seizures, often can cause this type of lupus. Next slide, please. So we know that because lupus is often associated with kidney disease, we need to have frequent blood and urine tests. And we know that we look at the ANA, as said before. And if that is positive, we probably want to go forward and look at the serum complement. We want to look at the ESR and the double-stranded DNA to be more specific if you have lupus or another connective tissue disease. We also know that some people will need a skin biopsy or a kidney biopsy to get down to the diagnosis and staging of how far the disease is and what might be the best way to treat that person. Next slide. So ways to treat lupus are many. The first line is non-steroidal anti-inflammatory drugs such as NSAIDs. These are over-the-counter things such as aspirin, ibuprofen, naproxen, and these can be treating mild symptoms. Corticosteroids, this is prednisone. It might help reduce swelling and tenderness and pain. Now, this is not the same drug that athletes use to build muscle and kill themselves with. Those are anabolic steroids. These are very useful, but they also have their own dangers too. And we know that when you take this, you have to get off of it in a reasonable period of time, and you can't just stop it immediately. You want to detox yourself off it. It can be taken either as a pill, it can be a shot, or it can be used externally as a cream to apply to the skin. And lupus symptoms generally act real quickly and regress after you take a steroid, either externally or internally. Interestingly enough, one of the best treatments for lupus are anti-malarial drugs. So we're back to our old friend hydrochloroquine, and also hydroxyquine. And these are used for patients with inflammation of lungs, fatigue. It can stop the joint pain. And these are probably front of the line to treat lupus patients. We also know that immunosuppressants like methotrexate and other chemotherapy drugs are used in severe cases of lupus. It's not something you want to use for a mild case, but if you have an organ damage, it's something that could save your life. Next slide. So in addressing the issues of lupus, we know that there are three roots. There are genes, there's digestion, and inflammation. And there are many branches of considering where this lupus comes from, where it can go. and how we can treat it. There are literally thousands of branches that all lead back to these three roots. Next slide. So consider that with lupus, you have chronic inflammation. So some people believe that if you eliminate animal products, that they are a major source of chronic inflammation. These products from animals include dairy, cheese, yogurt, milk, meat, including beef, pork, fish, but concentrating a moment on dairy. A lot of people think they're eating healthy when they eat yogurt, when they drink milk to strengthen their bones. But in a story that I looked at over the past few days, we know that cows are kept pregnant so that they can deliver tons and tons of milk. And they're also treated with these machines that milk them 24 hours a day for 10 months out of the year. Well, two things to consider. We know that these cows, an udder, when a calf is nursing, if that udder is infected, that udder shuts down and the baby calf can't draw milk. But with the machines that are hooked up to these cows, it doesn't matter. It'll take the infected milk with the pus and everything in it. And they say, well, it's safe because they pasteurize it. So you're drinking dead bacteria, but you're basically drinking sterilized pus through a straw. The same with yogurt, which is a bacterial culture anyway. And cheese is a concentrate of milk. I understand it takes 7 pounds of milk to make 1 pound of cheese. So you're eating that infection. The other thing we know that inside milk, there's a protein called casein. And casein is an inflammatory protein. It causes inflammation. It turns on cancer genes. Studies have shown that there may be 3 times the increase of ovarian cancer, increase in breast cancer, and prostate cancer. And this could be the basis that estrogen is the basis of some of those diseases. There's also the potential of something called mimicry, where some of the protein in casein mimics some of the pancreatic hormones, and you can develop an antibody to those pancreatic hormones and possibly develop what's known as type 1 diabetes.
Dr. Maxie vegan? No, he talked to somebody this week.
Somebody needs to mute. We also know that osteoporosis can happen when you drink milk or when you have yogurt because of the acidic levels of the milk and the casein. And we know that this acidic levels leach calcium phosphate from the bones. So people say, well, how do I get my bones strong? Well, you can do things like eat kale and spinach and other things have a lot of calcium in it without the negative effects of that. We also know that casein can also be an allergic trigger so that people later in life can develop asthma and food allergies and fruit allergies. But once they stop using dairy, many of those allergies decrease or go away. Next slide, please. There are some people who believe strongly in healing nutrients, me being one of them, even though I'm a more recent convert. And we believe that raw vegetables that are full of phytonutrients and enzymes are the best. A lot of people eat cooked vegetables, but in cooking a vegetable, you lose a lot of the value of the nutrients. And of the vegetables that are good to eat raw are the cruciferous vegetables, such as broccoli and cauliflower. We talked about those a week ago, but those are extremely good, and kale. And one of the reasons that these are so good and even better than fruit, these vegetables grow in the dirt. And the dirt or the earth is full of minerals, and minerals are part of what we need. We've talked many times about the need for micronutrients and minerals, and we have suggested prenatal vitamins. But an even better way and more natural way to get those are through the cruciferous vegetables, broccoli and cauliflower. Things like kale are good. Also, we need something known as omega-3 fats, and those are obtained easily from chia seeds, flax seeds. But it's important not to just take a whole flax seed or a whole chia seed, but we recommend that maybe a half a cup a day, but you grind them right before you use them. You can put them in salads, you can put them in other foods, you can put them in a blender, you can put them in a smoothie and take it, but they have the omega-3 fats in it, and that's very important. We know that all of our cells are made with a membrane around it, and that membrane normally has a lot of omega-3 fats in it. And it's important for your metabolism to keep that membrane alive, to keep it porous, so that food and signals can get into it and the toxins can get out of it. We'll go into detail about that at a different time. So we know that supplementation is important with omega-3 fatty acids, and that goes through a pathway and develops something called alpha-linoleic acid. And that can be obtained through a DHA supplement or through those processes mentioned above. Next slide. So consider chronic inflammation. We know what acute inflammation is. If you bump your head, if you hit your knee on the side of the bed, that can be acute inflammation. But we're talking about chronic inflammation. And one of the pathways, the main pathway for chronic inflammation in the body is called the omega-6 pathway. And that omega-6 pathway is gone through when you eat fish, when you eat meat, processed food. The other pathway that produces things that are agents that are anti-inflammatory is the omega-3 pathway. That's where the chia seeds, the flax seeds, the omega-3 fatty acids come through. And so the product of going through the omega-6 pathway is something called arachidonic acid, which creates inflammatory agents. I won't go into detail on that. But the pathway of omega-3 and chia seeds and flax seeds leads to alpha-linoleic acid, and that creates anti-inflammatory agents. And I'm going to urge many of you and me to try that and see what happens with your knee pain, your joint pain, the back pain, and also your general feeling of well-being after trying to get rid of some of these inflammatory agents. Next slide. So we know that the lupus also raises the risk of other health problems. We know that there's more coronary artery disease with lupus, high blood pressure, high cholesterol, and type 2 diabetes that occur. We know that lupus causes inflammation, which increases the risk of coronary artery disease. We know that patients with lupus may be less active because of fatigue. They have joint problems and muscle pain, and that, of course, can lead to cardiovascular disease, coronary artery disease. There was a recent study in women with lupus and showed that they were 50 times more likely to have chest pain or have a heart attack than women of the same age of other groups. We know that medicines that treat lupus may also cause bone loss and lead to osteoporosis. And so that is something we are concerned about. You don't want to have weak and brittle bones. We know that more than half the people with lupus have kidney problems, and this generally occurs within the first 5 years of lupus symptoms occurring. So we need to make sure that you get regular urine and blood tests if you have lupus or symptoms of it at all. Next slide. So if you have lupus, think you have lupus, or being consulted on for that, make sure you record your family history as best you can, interview your relatives. This includes cousins, uncles, aunts, to find out, is there any trend going on in your family for that? Record any symptoms that you or they have, even if they seem unrelated, because they might be, and that needs to be shared with your physician or a healthcare professional. You need to see a specialist who has experience in dealing with your most major symptoms. For instance, if you have symptoms of inflammatory bowel disease, you want to see a gastroenterologist. But I think that all of these should start at a family practitioner, general practitioner, internist before you get out to the super subspecialist. And don't be afraid or ashamed to get a second, third, or fourth opinion. A lot of people aren't diagnosed for 5 or 10 years, and they go through 10 or 12 doctors to get to a diagnosis of lupus and get adequate treatment, and especially people of color. Next slide. So there are some medical specialists you may need to consult. You can consult a nephrologist. They treat kidney problems such as inflamed kidneys, kidney disease that happen with lupus. And these are the best doctors in the world, those nephrologists. That's why they're at the top of the list here. Then there are the rheumatologists. They treat arthritis and other rheumatic diseases, such as scleroderma and lupus. Endocrinologists who treat glandular diseases, such as diabetes and thyroid disease. Neurologists, they treat strokes, muscle diseases sometimes as well, myasthenia gravis. Hematologists who treat blood diseases like anemia. Gastroenterologists who treat irritable bowel disease. Dermatologists who treat skin disease and nails and hair. And I'm adding on nutritionists. I think they're becoming increasingly more important to deal with the nutritional issues that surround most of our diseases. Next slide. So my advice, I think that's all the slides, Simon. My advice is that if you have chronic joint pain, if you have any symptoms of lupus, discoid, or systemic, that you should have it checked out immediately. And don't be afraid to ask for a second opinion or a third opinion. But lupus can be an extremely dangerous disease, especially if you're a woman of color and of childbearing age. Now, those are the people that it's most frequent in, but those are not the only ones that it will affect. I thank you for your time. Let's open the floor if there are any discussions or questions. And Simon and Dr. Jordan, if you can help me with the chat, if there are any questions or thoughts. Dr. Neighbor, I know you can't see the chat, but you're welcome to comment.
Okay, can you hear me?
Yes.
Yeah, there's a part of my family where about 25% of the women in that segment have lupus. In fact, my great niece spent 3 years and 3 months at the University of Chicago Hospital before she was stabilized. We've got her to move out here. So it can be, with some people, very devastating. I think it is extremely important to get, for people who have lupus, to try to have it diagnosed as early as possible, and for them to really have a physician whom, lupus preceded AIDS in terms of someone who has it needs to have a physician whom they can go to and trust. That is not a disease, that is not a condition that you play with. It can affect any part of the body. It is one of the great mimickers, so it can come on like anything. And see, the attitude of the patient is extremely important to make sure they find a doctor and they follow. And if you don't like them, let's find somebody else. But that patient needs to be being treated and managed by someone whom they can relate to and whom they trust.
Thank you,
Dr.
Dr. George.
Maxey,
Yes.
Dr. Maxey, I wanted to add a couple of comments. You covered a lot of the information, the pertinent information, but some of the nuances and subtle things that I wanted to make sure are shared. Number one, when lupus occurs in men, and it does occur in men, it is usually more severe in African American men. And there are, because of the work done by the Human Genome Project, there have been specific sub-allele types that have now been identified in those of African descent. So there is a lot of new information coming out that will help make the diagnosis of lupus perhaps easier. But one of the reasons lupus sometimes takes a long time to diagnose is because, unlike diabetes, where you have a marker, a high blood sugar that you can hone in on, lupus can be very, as Dr. George said, a mimicker. It can occur with just one of many of the symptoms, and it can be subtle. And unless you take a really good history, you won't necessarily see the dots to connect. Frequently, there is a history of night sweats, and sometimes that gets confused in a middle-aged woman as the beginning of menopause, or the fatigue. The patient may not say it, but what you want to tease out is the fatigue that they feel is out of proportion to the amount of exertion that they have expended. It's a weird kind of fatigue. The rash may come and go, and they may not pay attention to it. They may think it's a fungus or something and not paying attention to it. The lesions in the scalp that you mentioned, there are many cases that are actually first identified by the hairdresser, who can look through the hair and sees that there's different lesions in the hair. So it is a difficult diagnosis to make if it's not one that's just very explosive in development. I had a young patient, a 16-year-old, who had lupus, and she presented with high blood pressure and protein in her urine, just out of the blue. It is a difficult disease to diagnose, but if you don't feel right, or if you see things that you know are not right about you, don't let somebody put you off. Persist until you get your diagnosis.
Those are excellent points. Now, just because Dr. Walks isn't here, I got to ask you to define one word. What is an allele? Dr. Neighbor.
Yeah, it takes a second to get off mute on this phone. The story about SLE is evolving because of its genetic implications. So when you have your chromosomes, the chromosomes are made up of parts, and those parts, subunits, and those subunits are called alleles. And you can have multiple alleles with foci, and different points on that allele in that subunit are being tied to different diseases. That is the wonder of the Human Genome Project and work that is continuing on trying to tie down the genetic basis of disease.
And that point about the hairdresser is very also important and interesting of how things get diagnosed. And that's why it's important when you go to your doctor to everything that is wrong with you or every complaint you have, and you don't think it's important to share that with your physician or healthcare provider, because it may take time to link or put a line between all the dots to figure out what is going on. Also, the point that Dr. Neighbor made about the perspiring or sweating in a middle-aged lady, that may or may not be the onset of menopause. It could be related to the elevation of temperature that may occur with lupus or with infection. So there are a lot of things to be considered with this lupus, which shows a chronic inflammatory state that can wax and wane. And you can have temporary remissions where it seems that the disease is gone, then it comes running back to you. And it can also have emotional effects and psychiatric effects on patients as well. So that's why I brought up the issue of the nutrition, because that is also a part of the treatment of some of this. And you can also have more than one connective tissue disease or autoimmune disease going on at the same time. You can have lupus, at the same time you have Sjogren's syndrome, at the same time you have systemic sclerosis. Some unfortunate people have a lot of things going on at once. And we do also know that type 1 diabetes is an autoimmune disease. So there are a lot of things that we have to consider. Is there anything else in the chat? Anybody have any questions or comments?
Let me just comment. The last two male patients I had referred to me because they were complaining of profuse night sweats. Everything else, TB, all work up negative. Both end up having positive lupus tests. So I think it is very important. We do see it in men, much rarer than in women. And someone asked a question about whether it was genetic. I don't know if you can say definitely, but like in my family, certainly I have one niece, both of her daughters have lupus, and one granddaughter. So I would say that was genetic. It's something we should keep in the front burner in terms of things to consider and think about.
Was there any study on those people, Dr. Jordan, of their estrogen levels?
No.
No. Because we do know that men who get breast cancer have abnormal estrogen levels.
Yeah,
we know
I might call one. I still see it. I might do that.
And we know that people with lupus tend to have higher than normal estrogen levels.
Right.
That's why it affects women of childbearing age. So it'd be interesting to know about those men who get lupus and or breast cancer, which is not frequent in men, but it does occur. I've had at least 2 or 3 cases that I've seen myself in male patients. Have you read anything on that, Dr. Neighbor Stevens?
What I have read links the X chromosome with the, which is where the allele is found, the different alleles found for lupus, not the estrogen levels per se.
Okay, all right. So, and is the chat box empty?
We had someone who wanted to see this slide again, so I put it up.
Okay. Okay. So is there a specific question, or do you want me to explain it again?
No, there was no question. They just wanted to see this particular slide another time.
Okay. So this is a slide that asks you to consider if animal protein products are eliminated, does that decrease or stop chronic inflammation, especially that occurs in the joints. It also suggests that part of that chronic inflammation and allergy comes from dairy products. And they suggest that one of the culprits in the dairy products is the protein that is called casein. And we know that it is an inflammatory protein, and it's been thought to turn on certain cancer genes and also lead to allergies or propensity toward allergy and asthma and food allergies and fruit allergies. And it also, because of its acidic level, can affect taking calcium phosphate out of bones and possibly leading to what's known as osteoporosis. So that these are things to consider. We didn't go into a factual proof of these, but they're things that we have under consideration. I think they're pretty good considerations. Any other thoughts? In terms of other updates that have gone on, I continue to see an awful lot of people still unvaccinated. And in their unvaccination, they're coming down with COVID. My oldest daughter, who's a registered nurse at a hospital in just north of Manhattan, says the hospital is full again with full-blown COVID cases. Mostly people who are unvaccinated, but still people who are vaccinated. And the unfortunate part is that because of some of the confusion with the regulations, they have now relaxed the rules on allowing patients to have COVID positive patients to have visits from their families and not requiring masks. And we also know that the regulations on flying domestically have removed the requirements for wearing masks to fly domestically. I think there still are rather stringent conditions for coming back into the US if you're coming in from outside of the country, but these crazy people are flying domestically with no mask, and despite sitting right next to other people who may or may not be vulnerable, and that is still a problem. We also spoke last week about Paxlovid and the relapses, and I believe that the opinion officially is still that that's a good treatment, and it does work as an antiviral. But there have been some people who've had relapses, and thinking that if you have a relapse and are very immunocompromised, it might be worth trying a second dose. If you're not significantly immunocompromised, but you meet the other criteria, you probably would not benefit from a second dose of that. Any thoughts on that, Dr. Neighbor-Stevens?
As you started it off, the consideration is it is not a perfect antiviral. In some people, they have had the infection to flare back up after completion of the first course because it did not totally eradicate the virus, and they've had to go on an extended course of therapy to totally eradicate the virus. But as you said, it is still considered appropriate for use.
Now, some other experts have looked at that and said, well, maybe the 5-day dose, a 5-day course wasn't adequate in the first place, and maybe they should have had a longer initial course. I think that's still being evaluated. You have any thoughts on that, Dr. Steiner? Any of our advisory members?
Yeah, okay, here we go. I just unmuted. Yeah, to echo Barbara on this and yourself, Pfizer's now testing a 10-day therapy. And I've had several family members and friends already on Paxlovid. Some responded incredibly well, 24 hours, and the fever broke, they were great, they were terrific. And I have others that had the rebound that they're talking about that continued to test positive. I'm just thinking of two women last week in my family, one being my sister and one being cousin. They both had the rebound. They both continued to test positive for at least a week after Paxlovid and have symptoms. And then about a week or so after that, they did fine. So I think this is it's a moving target. I think we'll know more in about a month or two. And I think it's probably, I wish Jordan was here right now, but I think it's going to end up being probably a 7 to 10 day course is what I think it's going to point to.
Yeah, I think you're right about that. Are any of our other advisory members on? Is Dr. Rhonda Johnson on? Dr. Doss?
And this is Dr. Jordan. The problem with it is getting the history. Is the patient coming in as soon as he or she's feeling symptomatic, or are they been symptomatic 4 or 5 days? I mean, when they're really close to the first day, I'm feeling symptomatic, I'm taking it, I've had good results within 5 days. But if when you were 5 days symptomatic before you started taking it, you may need to take it more than 5 days. I think that becomes the issue of how patient we are in trying to determine whether the patient was really just starting to be symptomatic or not, and taking the history to see where they were. But I agree. I think it's going for many people, 5 days is going to be sufficient. But for others, I think it's going to be between 7 and 10 days.
Okay. I had an unfortunate consultation yesterday, which unfortunately I got extremely angry with the patient that was referred to me. But this family called me and they had a 90-year-old grandmother to come visit. The person that would come to visit was an anti-vaxxer. And she had tested positive 2 days before the 90-year-old lady came. And of course, the 90-year-old lady came down with COVID. And they were asking me, what can I do? And I was just so angry I could almost not talk, but I did recommend that she get the Paxlovid, and that I didn't tell them they ought to beat the anti-vaxxer in the head, but that's what I thought.
That's what you should have said.
Yeah, but just people have no consideration of their relatives to let that old lady come for that kind of exposure was next to criminal. So, but I did suggest she go, and then she wanted to know, because the anti-vaxxer lady didn't want to get vaccinated, what should she do? And
stay away.
I like
that. Stay away. I mean, people can't. Everybody can't have their cake and eat it too. When we were kids, the country was really rural, and people did things differently. My uncle and aunt who lived on our land, Mr. Buddy had never eaten bread until his wife got sick, because she cooked everything. They went out in the field. They tore the wheat, the corn, everything they had in their house was all natural. And I can still remember the look on his face the first time I took him a plate of food with 2 slices of Wonder Bread. And he looked at me and said, "What is this?" Because he never had that. Those days are gone.
He didn't know that Wonder Bread makes you strong in 12 ways.
Remember that old commercial? No, he didn't know it. He never had it. But my point is, they had cows, they had everything, but it was from their land, and it was different than what people see now. You were right earlier talking about processed milk. I mean, we drink it, that doesn't necessarily mean it's been sterilized. It's just been processed. What we get now is very different than what we got when we were kids living on the farm. I mean, in the population, the number of people, you can't expect it. I have a friend, they own one of the 3 largest cattle ranches in the country. It is 6 miles by 10 miles. And all you can see is just cows. I mean, try to imagine 6 miles by 10 miles, and it is cows, cows, cows. But when I never even thought about it until he said, you know, we got a country and a world to feed. You can't feed them with 3. And it made sense then. You think of how many cows are being killed every day to accommodate our population. There is nowhere in this world that is all done sterile and everything is healthy. I mean, the part of it is how healthy are we and how healthy is our ability to withstand some things. It was just, you know, amazing when you think of it.
Yeah, I want to comment on what you said about processed foods a moment. And I think they are at the base of a lot of our symptoms, a lot of our diseases.
I agree.
I know a lot of our people claim that they're vegan. But if you go to Walmart, you can buy frozen vegan food. And sometimes it's frozen, you can buy frozen vegan fried chicken.
Mm-hmm.
And a lot of this stuff has oils in it. And they're saturated oils, which are basically poison. There are a lot of people who claim to be vegan who have all sorts of chronic inflammation now that I see the slide up. And so they're being labeled as health foods. In fact, if you have to label something healthy, it's probably not healthy.
Huh.
And in a grocery store, one of our presenters a few weeks ago, I think it was Dr. Cutter, said, when you go to a grocery store, you should shop the outside perimeter of the store where the fresh vegetables are, but inside where stuff doesn't require refrigeration, where it'll be there for 6 months or a year and nothing will happen to it, that is not the food you should be eating. That is processed food.
Mm-hmm.
So we've got to learn how to eat fresh food. I like what Jordan was saying about eating fresh food. And I also had a comment that eating vegetables is better than eating fruit, even though there's nothing wrong with fruit. But if you are to make a plate, it should be 75% vegetables that grow in the ground, because that's where the minerals are, versus 25% of the fruit that comes from the top of trees, because the transmission of minerals and things to the top of a tree are not as efficient. The other thing that I recently discovered in a discussion, that we've talked about diabetes and insulin resistance. And I'm saying, what drives insulin resistance? Is it the saturated fats that come from animal products that coats muscle tissue and doesn't allow the insulin to do its job to get glucose in? And by getting rid of that animal fat, does that improve that? I don't know that to be a fact yet, but I'm looking into that insulin resistance, because so many things, and some of the testimonials that I read and some of the research that I've read showed that people who were diabetic, who changed their diet to get rid of things that had saturated fat, including meat, certain oils, etc., that their insulin resistance went away or went down, and therefore they weren't diabetic anymore by the definition. And So the problem is not necessarily in the sugar that you eat, but in the insulin resistance that is blocking your muscles from imbibing the glucose that it should. So I don't know if I explained that good or not, but those are some serious thoughts. Any of our other advisory members? I see Dr. Gibson. Is Dr. Rhonda Johnson on, or Dr. Dawes? All right, well, I thank everybody for their time. If there is, Simon, is the chat room empty?
I was just unmuted, Dr. Maxey.
Yes, sir. Go ahead, Dr. Gibson.
There are a couple of things. You asked what is an allele? An allele, I think in genetic terms, is a part of the genetic lexicon that identifies a phenotype. That notwithstanding, it is, I think, addressing a question as to whether or not lupus is a genetic condition. It is very definitely a genetic condition, and there's great and extensive documentation of that fact. And also, finally, on the issue of rebound after the use of Paxlovid, what we're finding, and I think probably, I suspect anyway, I'd love to hear what Dr. Jordan has to say about it. We're only just beginning to learn more about the capacity of antivirals, even a repurposing of antivirals in the use of and prevention of hospitalization and death in COVID-19. He hit the nail right square on the head when he said that folks are not getting treated early enough for the 5-day treatment to work. So to Dr. Steiner's concern, Dr. Ashish Jha just this past week in a White House conference on the issue of rebound with Paxlovid, he suggested that probably the usefulness past the 5-day limit, if in fact it's taken properly, that's with the caveat, if it is taken immediately upon observation of symptoms of COVID-19 for the 5-day course. Taking it longer than that, the jury is still out as to how much benefit could be had by extending that dosage. What we do need to do is to keep an eye on the results of not only Paxlovid, but other antivirals in the treatment of COVID-19, because there are numerous examples, I believe, of the repurposing of older products, antivirals for COVID-19, that I think are legitimate and hold promise. Thank you.
Let me add one thing to that, and thank you. Paxlovid is 2 different medicines, and one of them is ritonavir, which is an old HIV medicine. Is the second HIV medicine protease, the second protease to come on the market 30-some years ago. We have used ritonavir over the past 30 years, not as a primary drug because it tastes so bad and it can mess your stomach up, but it's a pharmacoenhancer. It's one of the best pharmacoenhancers that we've had, and you're using it in cancer treatment now. And pharmacoenhancer means you take it and it elevates other drugs. So the Paxlovid has 2 other medicine, has another medicine, it's 2 pills. You take it with the ritonavir. The ritonavir boosts it, but ritonavir can give you that awful strange taste in your mouth. And when you said it, I had 2 patients stop taking the ritonavir because when they didn't take the ritonavir, they didn't have the bad taste. But if you didn't have the bad taste, you didn't have a high enough level for it to be effective. So you're right, we have to understand that they will start using, old drugs will be used again, and they've got to be used correctly. You've got to use it early enough. You can't come in the 5th day and expect it to work. You need to start the 1st day, but you got to take the whole pack. You can't take part of the pack. Otherwise, we will end up not having the right outcome. Thank you for saying that, because we've had 3 patients do that.
Dr.
Thank you,
Max?
Dr. Jordan. Yes.
You know, this comes back to the lecture that we talked about, that I pointed to, that about having a plan. And as soon as people get COVID, they wonder, well, what should I do next? And so I think we have to stress the point that Paxlovid is now available everywhere. That I've spoken to people in small towns and in big cities, and they were able to get their hands on it quickly. And I think it behooves us to point out that have some home tests and find out soon, as soon as you get ill, whether or not you have COVID, so that you can go get treated appropriately quickly. Because as all the participants today said, the ideal time is, of course, before the 5th day, but it seems to me that sooner is better. So I just wanted to stress that.
Thank you. Dr. Jesse Sherrod, I know you've done some research on chronic inflammatory states. Do you have a comment? Can you unmute Dr. Jesse Sherrod?
Well, Dr. Sherrod is being unmuted. I'll circle back to lupus for a nanosecond, if you will. Turmeric is an excellent anti-inflammatory product that can relieve some of the inflammation that would otherwise be treated by the more caustic non-steroidal anti-inflammatories. And it is important to get turmeric that contains piperine, which is black pepper extract. Why? Because that multiplies the power of the turmeric by 10 times. So it's very important that you use a turmeric product that has black pepper extract or piperine, P-I-P-E-R-I-N-E, at least 5 milligrams, and in conjunction with the other nutritional supplements that you mentioned.
Let me ask you a question, doctor.
Sure.
I've tried turmeric by itself. Like Dr. Jordan said, it can be nasty. What do you mix it with? How do you take it?
Oh, well, actually the turmeric that I use is called Doctor Recommended. It's available on some company out of Seattle.
What's the name of it again?
Turmeric, Doctor Recommended.
Doctor Recommended.
Yes, sir. It has a goldish tan label on it, and it's available at a very affordable price. You can get it delivered out of Seattle for the next day delivery, as a matter of fact. So that one has black pepper extract, 5 milligrams per dose, and it's in a capsule, so you don't even taste it at all. So that's that's not an issue. And the other thing I would say, circling back to Dr. Steiner's comments about having a plan, just like you need to have a plan in California for earthquakes, you need to have a plan for COVID-19. And that plan should be first, number 1, contact the doctor. Second, number 2, contact your local pharmacist. Number 3, contact your faith leader. Anyways, that's my comments. Thank you.
Thank you. Thank you very much. Did Dr. Sherrod ever get unmuted? Dr. Sherrod, are you there?
Good morning, Dr. Max. Yeah, I'm here now. I was doing 2 programs. I'm sorry. So what was the question?
I know you've done some research on chronic fatigue, chronic inflammation, and nutrition. I wonder if you'd share some of your thoughts on that.
Thank you, Dr. Maxey. I have been doing research on chronic fatigue syndrome, fibromyalgia, as well as long COVID, and they are a very similar mechanism. And what we're finding, and what the literature is showing, that there's an imbalance in the immune system. You are either, and this is related to your cytokines, those are the inflammatory those are the inflammatory molecules that we measure. So you can be either Th1 dominant or Th2 dominant. And that means that certain cytokines are elevated more than others. Some having to do with the T cells, others having to do with the B cells. And there are actually certain nutrients. And I would have to get you a flyer on that, but there are certain nutrients that you should avoid if you're Th1 dominant, because what you want to do overall is to keep those cytokines in balance. So, for example, for me, I know that I'm Th2 dominant because I have done my cytokines. And I know that I could never drink coffee, but I didn't know why when I was in medical school. You know, when you get ready to go on rounds, everybody get a cup of coffee. I would be wired for days. And that's because I'm Th2 dominant, and that was stimulating the Th2 dominance. So that is getting down to the cellular level and maybe a little bit too complicated, but I think it's something that we should be aware of, because once you stop using those agents that imbalance your immune system, you will return more back to normal functioning. And it has also, it integrates with your thyroid. You know, but the nutrients like gluten destroys your thyroid if you're gluten intolerant. And a lot of people, that was one of my, and you know, I hate to talk about myself, but that was one of my major problems, was this Hashimoto's thyroiditis. And I had antibodies up to the thousands, and every physician I went to didn't have an answer for me. They just said, you're going to become hypothyroid because your immune system is destroying your thyroid. Well, the gluten molecule looks like the thyroid. So, and I found out later that I had to do my own DNA testing. I found out that I was non-celiac gluten intolerant. Once I came off the gluten, my antibodies to my thyroids went down from 1,308 to 1 to 265. And now they're down to 1 to 63 because I've been gluten-free now for about 10 years. Normal being in less than 100. So food is a major player. That is the basics of autoimmune disorders. And the other thing, I don't know if you mentioned it or not, is this GMO food, that genetically modified food, which the body doesn't know what to do with. So, you know, we need to be very conscious about what we're eating. And we know that in the United States, the law, it was outlawed whether you could label the GMO and non-GMO. In Europe, they know what they're eating, whether it's GMO or non-GMO. But genetically modified food tricks the body. It doesn't know what to do with it, and it creates inflammation.
Thank you so much, Dr. Surratt.
Yeah.
And it makes some company rich.
Okay.
Yeah, with the genetic modified foods, yeah. And the processed foods, you know. And like they say, with more names on labels on food, the less you should eat it. You want natural food that's grown, that comes out of the ground. Nature promotes nature. And a lot of this chemical stuff is really, I think, underlying a lot of the inflammation, chronic inflammation that we are experiencing in America. And I really do think, too, that the reason America has such a really very difficult time, besides all of the systemic problems, was the basic American diet, which is the standard American diet, which stands for SAD. And we know that the farming techniques have depleted the soil of minerals. So even when you're eating organic, you're not getting the minerals that you need because they're not in the soil. So you do have to do a little supplementation for your minerals, because the soil, because of the farming techniques, the soil is depleted.
Well, thank you, Dr. Surratt. Let me take a little turn for a minute. I heard something that caught my ear today, and I just want to drop it into the Wheaties here a minute. We know that much of the political divide in this country seems to be because of the declining birth rate of the majority population. But something caught my ear this morning, that same declining birth rate is not just in the United States, but in the dominant countries of the Western world, including Europe, which includes Russia and those other countries. And much of this conservatism or right-wing politics that is anti-immigrant, anti-people of color, that despite all of these health disparities that I believe have been created as part of structural racism, hadn't deterred significantly the birth rate of communities of color. And that political perceived division is the basis for a lot of the larger issues that we see that are covered behind a veil and under cover of things like voting rights and abortion rights and all these things. I wonder if there are any comments on that before we close.
Yes, sir.
Yes.
It's Dr. Jordan. That's been the issue from when, again, we were kids. The whole thing about the original Roe v. Wade. There's always been this fear of middle-class whites do not have as many kids. So many of them will go to Europe and other places to adopt kids. There's been an effort to stop poor whites or other white women from having abortions because there is the belief that their kids are going to be adopted. So go ahead and have it, even if you don't want it, it'll be adopted. Now, that ain't the case. Middle-class Black folks don't adopt that much. But one of the real issues that this whole thing is raising goes back to the issue of fear of a minority takeover, period. And we don't talk about it, and they don't talk about it, and we talk about other things instead, but that is one of the real issues. I can remember, again, my little hometown where congressmen would talk about those things, and you got to make sure you all have the babies because they're going to take over. And I didn't know what they were talking about. Who's going to take over what? And it was weird. But that has been a big underlying fear. If there are some tapes of some particularly Southern congressmen stating things, but that is one of the real big fears that they have, period.
No, thank you. I thank everybody for joining with us today. Dr. Barbara Neighbor-Stephen, do you have any final words?
No, other than stay informed. Don't let other people lead you down the wrong path with misinformation. Try to get as much correct information. There is talk about monkeypox now. A very interesting scenario is developing. Not a lot of answers. No one understands why we're seeing
Yeah, I think your transmission temporarily is not good.
I have one comment, Dr. Maxey, if I may, before you close.
Yes.
Note to attendees, America's favorite immigrant, who happens, by the way, to be a South African American, has at least 5 sons, at least that I know about, last checked. And he doesn't look like the people on this call. America's favorite immigrant, that is.
Who is that?
Think about it.
I
Tesla.
Oh, is he from South Africa?
He's from South Africa. He's South African American.
I didn't know that.
That's right. But, look around and think about, the Twitter drama and et cetera, And there's a lot to think about, a lot to unpack on that, those last comments that were being discussed.
Okay, I see a hand. Whose hand is that? Simon, can you tell me whose hand that is?
Hi, Dr. Maxey. It's Rhonda Johnson. I
I've
just
been
want
looking for you.
yes, I'm sorry. I just want to caution Dr. Maxey when we have to realize that these are very complicated. You have to look not only at what's happening in the United States, you have to look at the population in the world. The world population now size is almost 8 billion people. And we're looking at a significant shift in the world population dynamics. So, and the population dynamics worldwide is for people of color. It's not just a certain group. Overwhelmingly, the population of the world is becoming brown and Black. You have China has over a billion people. You know, India has, I don't know how many, but you know, and the demographics of European westernized nations are the population growth has not kept up. There's also a change, you know, we talk about global climate change, and there's also a shift in resources. You know, where are the resources in the world right now? And they are in these countries where the people are Black and brown. So we have to just look at the whole thing. I don't want to try to simplify this, you know, and just call it one thing. We have to tease out all of these forces, which are really happening simultaneously. You know, the world is shifting. What we're seeing a shift. We're seeing a shift in energy sources. We're seeing a shift in currency. There's a population shift, a climate shift. We're in the middle of a whole lot of things that are going on at a rapid sociological in terms of evolutionary time. So, you know, I want to caution us from just oversimplifying because it's a lot more complicated. That's why the reaction is so exaggerated. You know, that's why people are getting more entrenched and trying to preserve the status quo because of the fast pace of change. So I just say that, and then, you know, if we really want to have this conversation, we would have to look at population growth in Black America here. But again, it's getting difficult to count because we are now in a situation where, you know, how do you count, quote, Black? You know what I mean? Are you going to count native born who were enslaved here in the United States, descendants, or do you increasingly count the immigrant population from Afro-Caribbean, African and Caribbean population? So again, it gets complicated. So I want to just caution us from oversimplifying without doing justice to the real issues that are at hand. That's all.
I think your points are well taken. But being well taken, I just want to comment. Some years ago, I had the interesting honor to be the physician to the president of a brand new country called Zimbabwe. And what I found sub rosa, or under the cover at a state dinner, was my seatmate was the ambassador from China. And there's an intense battle going on between the United States, between China, and at that time, Russia, for the natural resources of the land, the continent of Africa, where a lot of the world's natural resources are. So what Dr. Johnson is saying, there's a worldwide struggle for ultimate survival of certain interests. And it's not a simple problem, but we're facing them. And it's not just whether Stacey Abrams becomes governor of Georgia, but it's a whole world dynamic, and it is complicated. But at some point soon, I think we need to start addressing parts of that, because we have to know what's going on more than we do. But again, thank everybody for their participation. Thank you very much. Enjoy the rest of your day and have a healthy, happy, and as Dr. Stevens says, use common sense. Stay safe.